सो मेनी मदर्स कम एंड आस्क, अरे मेरे फेस पे तो इतने हेयर थे ही नहीं, इसके फेस पे, इसकी बॉडी पे कितने ज़्यादा हेयर हैं, वॉट कैन वी डू टू रिमूव दीज हेयर? सो फर्स्टली लेट मी bring back the basic concepts to you. Every newborn has very fine thin hair on her or his face or on the body. These are called lanugo hairs. These hair are very important for thermoregulation because baby's nervous system is not yet developed, so it is absolutely not recommended to remove these facial hair by massage, by uptan or by labes. It should not be done. Now, as the baby girl progresses towards adolescence, towards puberty, towards teenager, there occurs so many hormonal changes in her body. There occurs fluctuation in the levels of testosterone, estrogen, progesterone. So these hormonal changes lead to changes in the hair growth. Now, this hair growth is determined by genetics, not only from the mother's side but also from the father's side. So, it's not that the mother is saying, मेरे तो बाल थे ही नहीं, इसके इतने बाल हैं. So, it is important from the father's side as well. So, genetics plays an important role in hair growth. Secondly, there might be some underlying issues like PCOS, polycystic ovarian syndrome. You all must have heard about it. It leads to insulin resistance, which increases the testosterone level. Testosterone is a male hormone, which when produced in excess amount in a girl leads to thick, coarse masculine hair. So it becomes a concern. Then you should also rule out other disorders like thyroid or diabetes, which can alter your hormonal balance. So coming on to what options do we have for facial hair removal? I would recommend that in adolescence or teenage period, I would not recommend any sort of facial hair removal therapy because the girl's skin is still developing. It is very sensitive. From waxing, she can get a lot of rashes. From laser treatments, that won't be successful at this point of time because the girl is still developing. If you must have heard, laser treatments are usually recommended in mature, young, developed females after 20 years, after 18 years of age. So in adolescent periods, kindly let your children embrace their childhood. There is no need of facial hair removal. In teenage or in young women, definitely we have so many options. You can go for waxing, threading, you have laser options. Laser is successful. Laser has better outcomes, rather I would say laser has better outcomes in those who have particularly very thick hair, because if you go to the technology which laser is using, it is focusing on the dark pigmented thick hair. If your facial hair growth is very thin, you might need a lot of sessions than a person who is having thick hair. Lastly, I would say that it's everyone's own perspective. This is just skin. These hair are totally normal. So let us normalize the facial hair or body hair. At the end, physical appearances do not matter. What matters is how good of a human being you are, how kind you are. So let's normalize.